Jamie came to us serendipitously. She was a nursing school and they were doing EKGs on each other, and her EKG was abnormal. And she went to see a local cardiologist who did an echocardiogram, which is an ultrasound of the heart, and they found this mass in her left ventricle. Because of this mass, she went to see various cardiologists to evaluate this. Eventually, it was determined that they would try to surgically remove this mass. Our first attempt at treating this really was to kind of use the lung approach, where they try to cut off the tumor's blood supply. So we actually tried to do that by putting a coil, which is a little tiny metal. They're called tornado coils, and they actually look like a tornado when they go in. And they plug up the vessel and attempt to cut off its blood supply. This was unsuccessful because the tumor itself is actually a mass of blood vessels. It was an extremely frustrating procedure. Here's a girl, she's in her 30s, she's healthy, she's starting a new career as a nurse, and all of a sudden she's told she has this tumor. And then she's told it's extremely rare, and then she's told there's no treatment for it. So she was very frustrated, and they actually kind of almost felt like there was no hope. For me, the frustration really was lack of any medical literature to guide us. Everything we really do in medicine has some type of basis. And it's kind of really rare to be involved in something that's never been done before. We've all done new techniques and new procedures, but they've always had some type of basis to go by. One of the neurosurgeons was their laboratory, their equipment broke, and they had to use the cardiac cath lab for 2 weeks. And Dr. Babak Jeromi was using our cath lab, and we were able to kind of talk and look and see what he did, and he did a lot of similar things that we were doing. And as I mentioned previously, a lot of these AVM tumors are in the brain, a lot of the treatment of these. So I actually went to him and said if he had any ideas. And he suggested treating it similar to how they treat it in the brain, which actually is to go directly into the tumor and inject this tumor with a substance that would basically kill it. The problem was that it's a different set of equipment. The brain is not a beating organism. The heart is. So really it took a combination of a physician that used to work with a beating, moving organ, and then a surgeon that has a special technique to treat a tumor in the brain. Because this had never been done before, we had no idea what was going to happen. And it was actually very fortunate that we were able to coil off the blood supply, because this allowed this viscous substance only to go as far as the coil. So it actually stopped from going outside of the tumor and stayed inside the tumor. The biggest concern was we do her harm. She basically didn't have a lot of symptoms. She clearly was physically impaired, but she wasn't really in immediate danger of dying. And the problem was, if this would continue to grow, we know at least from autopsy series that it probably would have shortened her life. So the worst thing we could have done with Jamie would have been to accelerate any process or do harm to her heart. And so that's what we didn't know. And I think really the happiest part of this is that, okay, yeah, we successfully treated the tumor, but we actually did no harm to the rest of her heart muscle. In her, it was going to continue to grow, and it was already close to 3.5 centimeters in size. And you figure that the left ventricular chamber, that's pretty much the size of a left ventricular chamber. So as it grew, it was going to even get worse. So now we've taken this mass and we filled it up with this inert substance, and so it is no longer this tumor asking for blood. It is now an inert mass, and we actually have rescanned her with these MRI scans and found that there is no longer any blood flow. Even though the mass is still there, it's just an inert mass. And we'll watch it over time. We've watched it now for 4 months, and it stayed the same. And if you look at the blood flow to everywhere but this mass in her heart, it's normal. And that's the important thing. So she should have normal heart function, but have this inert mass that just stays there without causing any problems.